Thank you very much. If you're at this meeting, you hear a lot of connotations with Greek. So I'm going to start with that. Arthritis is a Greek terminology. Arthro means joint. Itis is inflammation. So it is an inflammatory disease that affects millions of us and affecting pain and stiffness on your joint. And the pain and the stiffness is not the only symptoms we have. What you get is depression, you get fatigue, you get stressed. So there's a psychological problems placed on the top of it. So if you think about that, it makes sense that arthritis is the number one cause of disability in this country and many other developed countries. So what do we need to do to prevent it? Well, unfortunately, there's no cure for arthritis. So what we need to focus on is to reduce symptoms, especially the pain and stiffness associated with arthritis. So exercise is very effective because it strengthens your muscles surrounding your joint, reducing your pain and reducing your stiffness. What about aquatic exercise? Well, aquatic exercise is very, very effective because of you are reducing your joint stress. Because if you go out and if you walk on the street, what's going to happen is most arthritis patients are obese. So they are carrying extra weight around. So it's going to aggravate your pain and the stiffness on your joint. So that's not good. So the swimming is great, as I mentioned to you. I don't know how many of you have done on the beach or in the pool, you got beach balls. If you put it in the water, boom, right? The beach balls come right up because of the buoyancy effect. Because of that, the stress that placed on your joint is much smaller when you're exercising in the pool, which is really great news if you have arthritis. So, what does research say about effect of aquatic exercise on arthritis? Well, this is one of the largest studies that has been done in this area. So they recruited arthritis patients and put them in aquatic exercise programs. And as you can see here, 6 months on and at 1 year, they are able to reduce pain around your joint through aquatic exercise programs. And another thing I want you to focus on here is that if you look at the sedentary group or control group, their pain got worse. So that's a hallmark feature of this disease, that your symptoms get worse and worse every year if you don't do anything. Okay, what about swimming? Well, swimming and aquatic exercise are very different form of exercise. And if you look around on the internet, you find a lot of pictures suggesting that the swimming is very effective for patients with arthritis. But if you try to look for research studies that specifically address that, you don't find anything. So because of this, we got funding from National Swimming Pool Foundation to conduct a swimming exercise intervention studies targeting the patient with osteoarthritis. So what did I do? What did we do? Well, what we did, is recruited a patient with osteoarthritis and randomly assigned them to swimming group and the cycling group. Why cycling? Because cycling is a well-established land-based exercise that is known weight-bearing in nature. So it is a great mode of exercise to compare swimming against. All right? So this is what we found. If you look at this graph here, the swimming exercise was highly effective in reducing pain in this patient with osteoarthritis, and magnitude of reduction is very similar to more well-established cycling exercise. When you look at the functional limitations, it is the same deal. Swimming exercise was able to reduce functional limitations, and effect was very similar to the cycling interventions. Okay, another issue that we addressed in this study is this. If you look at a heart disease patient, over 50% of heart disease patients have arthritis. And a lot of patients with osteoarthritis, they suffer from cardiovascular disease. And it turns out, if you have arthritis, your joint gets really stiff. But the same thing is happening in your arteries or vasculatures. Your arteries gets really stiff. It causes vascular disease through that. So the question is swimming effective in reducing stiffness of your arteries? And in fact, it is effective. As you can see here, the swimming exercise was able to reduce an index of arterial stiffness that we use in the research laboratory. You know, I found this picture through the archives in the history of medicine, but I think this is supposed to be a joke. It says it doesn't have to be hell to be healthy. Well, the swimming is really enjoyable, and you can exercise without pain. And I think swimming is the only one that you can show this kind of smile after you get done exercising. By the way, I need to meet this lady because every time I give a swimming talk, I put her there, but I've never met her. So that's all I have. Thank you very much.